Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Various muscles of the leg and its innervation, that is a nerve supply. So first one, it includes the muscles of the anterior compartment of the leg and the dorsum of the foot. Anterior compartment plus the dorsum of foot. So what does it include? It includes the tibialis anterior. Then comes the extensor hallucis longus, then the extensor digitorum longus. Then comes the PT, that is a peroneus tertius, as well as the EDB, as well as the EDB, that is the extensor digitorum brevis. So the nerve supply here is the deep peroneal nerve. So the muscles of the anterior compartment, it includes tibialis anterior, extensor hallucis longus, extensor digitorum longus. So extensor longus is present. The peroneus tertius, the extensor digitorum brevis. Then moving on to the muscles of the lateral compartment of the leg. So this will include the peroneus longus as well as the peroneus brevis, and the nerve supply is nothing but the superficial peroneal nerve. Superficial peroneal nerve. Next is we move on to the superficial muscles of the posterior compartment of the leg. So this will include the gastrocnemius, the soleus, and the plantaris. That is nothing but it is known as the GSP. So GSP stands for the gastrocnemius, soleus, and the plantaris. So the nerve supply here is nothing but the tibial nerve. Now, what is the deep muscle of the posterior compartment of the leg? So here in the deep muscle of the posterior compartment of the leg, what does it include? So here the deep compartment, the superficially it is the gastrocnemius, soleus, and the plantaris. This is the tibial nerve. Next is the deep muscle. It includes the popliteus, the flexor digitorum longus, the flexor hallucis longus, the flexor longus muscles, as well as the TP, that is the tibialis posterior. So the nerve supply here is nothing but the tibialis nerve, the tibial nerve. To learn and grow daily like this, please do subscribe.